Healthcare systems in many emerging economies face major challenges. There's a severe shortage of medical professionals, which often forces people to rely on unqualified practitioners or to self diagnose. At the same time, these systems lack basic tools for care coordination, which delays proper treatment. And for many, long distances to the nearest health facility and high travel costs make access to care even harder, often worsening their health outcomes. That's exactly where Medi AI comes in. We turn an ordinary mobile phone into a powerful frontline health assistant. Our goal is simple. We want to provide access to real medical advice even when no doctor is nearby. We want to fill infrastructure gaps using low-cost digital tools. And we want to remove the need for travel entirely by bringing care directly to the patient. So this isn't just telemedicine. It's accessible, scalable, low-bandwidth healthcare that works even when no doctor is online. It puts reliable medical support into the hands of anyone with a phone.
An important question is how it works. First, through an AI symptom checker, which can be via WhatsApp and USSD and voice chats. This can refer us, if necessary, with a consultation with a certified doctor, which is personalized in the patient, can be through voice, chat, and video. And finally, we can have the delivery of a prescription, which can be used in nearby pharmacies to obtain medicines. But it's also necessary to indicate the support that community health workers provide offline access. That it can be through recording symptoms and delivering message for non-smartphone users or for people without internet access. One question that may arise here is, what about the value proposition for doctors? We identify as a group the following on the slide. First, the experience in digital care. The second, flexible income opportunities. The third one, commitment to serving underserved communities. And the last one, no upfront certification required. Our business model is B2, B2C. This is premium model for patients, affordable doctor consultations, pharmacy referral fees, B2B API and licensing, and NGOs and government partnerships. This ensures affordability and reach, two key factors for long-term adoption in underserved communities.
What if getting medical help meant hours of travel, huge costs, and no guarantee a doctor is even there? Let's talk about the healthcare hurdles faced by millions in places like rural Kenya. First up, doctor shortages. In remote villages, there might be just one doctor for thousands, or sometimes none at all. Nurses and community health workers do their best, but serious cases, they're often left untreated. Now, even if you find a clinic, it's not always equipped. Basic health tools, think thermometers, blood pressure cuffs, or even reliable electricity can be missing. Imagine trying to diagnose or treat someone without the right equipment. For many, it's a daily struggle. And then there's the distance. People often have to walk or ride for hours, sometimes days, just to reach the nearest clinic. Add in travel costs, and seeking treatment becomes a luxury few can afford. Many simply stay home, hoping their illness goes away. But here's the thing. These challenges aren't just statistics. They're real barriers faced by real people every day. Solving them takes more than just good intentions. It takes investment, creativity, and the will to bring healthcare to everyone, no matter where they live. So next time you see a story about global health, remember, access isn't equal, and for some, getting care is the biggest challenge of all.
We're launching in Sub-Saharan Africa and South Asia, regions where smartphone usage is rising but healthcare gaps remain wide. Kenya and Bangladesh are our first two markets, supported by partnerships with local health agencies and NGOs. These partnerships include MRIF for community health, Safaricom for free data, NHIF and County Health for outreach support. We will launch in 3 phases. Phase 1, integrate patients and doctors. Our early adopters are uninsured workers, women in peri-urban areas, and people living far from clinics. For many, Medi AI will be their first point of structured medical guidance. Phase 2, expand network with labs and diagnostics. Our product design is multilingual, voice assisted, and intuitive for low literacy users, removing friction for mass adoption. And phase 3, integration of NGOs and health campaigns. This can be done by SMS campaigns and community health partnerships. We aren't building just an app. We're enabling Medi IA, we're embedding Medi IA into health ecosystems.
Medi AI brings together several key stakeholders: patients in underserved areas, certified doctors, local pharmacies, and community health workers who support access on the ground. A tech team builds and maintains the platform while public and secondary stakeholders like health ministries, NGOs, and donors help us scale and ensure impact. Medi AI is guided by strong ethical principles. We promote equitable accesses, use inclusive designs with encrypted data and clear consent, ensure transparency in AI, and follow an ethical funding approach inspired by the Doctors Without Borders ethos.
Here's how we're extending Medi AI's impact and building long-term value in the healthcare ecosystem. Let's go to our first core extension, Medi AI for clinics, empowering rural clinics with two key benefits. First is an AI assistant, patient tracking, and the second one is the workflow optimization. Our next major opportunity is an AI health worker assistant. These are voice guide tools designed for the community health worker, especially in the remote or underserviced regions. Finally, we see enormous potential in disease surveillance contribution. By aggregating anonymized data collected through our tools, we can spot health trends and patterns, detect early signs of outbreak, and identify emerging community health needs. This not only support the public health, but position Medi AI as a valuable data partner for the health ministries and global health organization. And here's our alternative solution, HealthBot. They are solar-powered kiosks equipped with basic diagnostic and AI strategy and a voice chat interface in local language. HealthBot offers 24/7 care, no internet or smartphone needed, making them ideal for remote and crisis-affected areas. They are scalable, low maintenance, and designed to extend care where no clinic exists. So let's sum up this presentation. So Medi AI isn't just a tech product, it's a scalable tool for healthcare equality. With the right partner and support, we are ready to redefine how care begins in the world's most diverse it, in the world most underserviced regions. Our vision is captured by one statement: healthcare within minutes, not kilometers.